This video demonstrates an advanced technique for contouring of the jawline, neck, and lips, the Nefertiti Lift, and the volumized or extended Nefertiti Lift. Hello, I'm board certified plastic surgeon Dr. Joseph O'Connell, and welcome to the Aesthetic Center of Connecticut. The Nefertiti Lift is named after the famed Egyptian queen, known for her great beauty and especially her perfect jawline and facial proportions. This minimally invasive technique is designed to provide the visual effect of a mini jawline lift and also to help with contouring of the upper neck and corners of the mouth. The best patients for the Nefertiti Lift are between the ages of 35 and 55 who desire improved definition of the jawline and have lost definition of the jawline and mandibular angle from the downward vector of the platysma muscle, but without excessive fat along the mandibular border. Before undergoing a Nefertiti Lift, patients are asked to contract hard on their platysma muscles by grimacing. Disappearance of the mandibular border, as seen in this patient, indicates the potential for successful treatment. This particular patient has elected to proceed with what we call the volumized Nefertiti Lift, utilizing Botox Cosmetic and filler. She's happy with the contour of her lips, and if lip contouring were indicated, we would also inject her depressor anguli oris muscles with Botox Cosmetic. The sites of Botox injection are marked prior to treatment, and generally 6 to 7 sites are utilized per side. As you can see, the injections are along the bottom of the jawline and into the thickened band-like area of the platysma that runs perpendicular to about the center of the mandibular border. Ice is applied to provide local vasoconstriction, to improve comfort, and to minimize the risk of bruising. The skin is then prepped with alcohol, and the Botox is gently placed with a very small needle. The exact location and depth of placement of the Botox is extremely critical, and the injector must be well versed in the nuances of the local anatomy. In the Nefertiti Lift, Botox is injected along and under the mandible and into the upper part of the posterior platysmal band. The posterior platysma band is grasped between 2 fingers and directly injected. Gentle pressure is applied following injection. This patient will be asked to refrain from exercise today and also to avoid massaging the treatment area. Tomorrow she can wear makeup and return to full activities. Side effects would usually be limited to bruising and swelling, but in Dr. Levy's series he had a treatment failure rate of 3%, and there were 1.5% with mild difficulty swallowing and 1.5% with smile incontinence. I believe that some of these issues are technique dependent. Here we see our patient 12 days following a standard Nefertiti Lift utilizing only Botox Cosmetic. There's better definition of the jawline and upper neck with a pleasing, very natural result. When she grimaces, the posterior platysma banding is effaced in the area of the jawline. To enhance our result, we've chosen to add volume to the mandible and create what we call the volumized Nefertiti Lift. This can be performed all in one sitting, but for the purposes of this video, we will add volume on a delayed basis to better illustrate the procedure. After standard prep and icing, we carefully inject filler in the areas of the jawline where additional definition is desired. We've camouflaged the jowl by injecting the area of the prejowl sulcus. I feel it's also important, however, to look at the aesthetics of the mandibular angle and ramus, but we must be careful not to masculinize the face. You can see that the injections are quite easily tolerated with minimal discomfort. Again, the practitioner must be intimately familiar with the regional anatomy, including the location of the mandibular and marginal mandibular nerves, as well as the facial artery and vein and other vessels. We carefully review the various options for filler choice with our patients, and filler volume can vary depending upon which product is utilized. At the Aesthetic Center, all Botox and filler injections are personally performed by me, and there are no nurses or physician assistants performing these procedures. The areas treated with filler are gently molded for a smoother result, but this must be performed very judiciously when neurotoxin and filler injections are combined at one sitting. Following completion of the volumization, you can see the natural enhancement of the jawline without creating an overdone masculine appearance. She should have minimal to no bruising, and makeup can be applied tomorrow. We can obtain even further jawline definition and tightening of the lower one-third of the face and neck by adding radiofrequency-powered microneedling with the Intracell device from JSIS. There are certain timing constraints that need to be followed, however, when Intracell is combined with filler placement. If you have any questions about the Nefertiti Lift or the Volumize Nefertiti Lift, or just want to learn more, call us at the Aesthetic Center. Thanks for watching. We're the Aesthetic Center of Connecticut.